Hello, I'm Robert. Welcome to my channel where I fact check stories that scare you. And this time I'm actually talking about some of the developments in vaccines. So we've got these really amazingly good vaccines for COVID. And recent news with Pfizer of it being 94% effective in Israel against the B117 variant at stopping even the asymptomatic cases. So if that really works out for the, if it keeps up like that with all the variants, then that would really be enough by itself to eliminate the disease. Even relaxing everything once everyone is vaccinated. But this is just a first generation vaccine, and we can expect better vaccines in the future. So I'm just talking a little bit about that. And first of all, why was Pfizer so effective? It seems to be one of the best of all, Pfizer and Moderna. And this is an interesting story behind that, which I didn't know until recently. So you've probably heard about the famous spike protein of the SARS-CoV-2, of the virus that causes COVID. And this is what it uses to get into a cell. And it uses kind of trigger a process. It basically says to the cell, I'm something useful. And then the cell says, oh, all right, yes, so you are. And it makes a chauffeur-driven little car, as it were. And it uses that to usher the virus into the cell. And but the cell is like a Trojan horse. It seems like a gift to the cell, but once it's inside, then the virus starts replicating and making copies of itself. So what the vaccines do is that they tell and then once your body discovers that once these viruses get into the cell and the cells all start bursting open and stuff, then and creating lots of extra copies of the virus. And that's when your body starts getting the alert and it says, well, there's something very strange going on here. We don't want this. And so your body then goes and then there's all these substances going around that have been managed to get into your body, but they don't look like the right stuff. And so what eventually happens is that your body's adaptive immune system develops these antibodies, which are little chemicals that stick onto the spike. So they look around in the bloodstream, they find this spike, and whenever they see something that looks like that, they stick on the end of it. And so now, if once you've been vaccinated, or if you've had the virus and you've had it for about 10 days, then after that, your body starts making these little things that stick on the end of the spikes, and that helps to stop the virus from going into the cells. So the job of the vaccine is to present your bloodstream and your body with lots and lots of these spikes. And then once it does that, then your body eventually says, well, that's not what we need, what we want in the body, and so it makes these antibodies. Now, this is what the spike looks like just before it goes into a cell. So that's what the cell is looking for, and this comes and it triggers this ACE2 receptor that you've heard all about, and then it gets in. This is what it looks like after it gets into the cell, after it fuses with the cell on its way in. And it's much longer and thinner. And so now comes the techie details. I don't understand the science here, but basically what happens is that the natural way to make these vaccines, then they present your body with this sort of a shape. And then what they had to do was try and make the spikes so they look like that. And so first of all, they need to actually image what the spike looks like before it gets into a cell. And so there's quite neat ways of doing that, which involves actually finding an antibody that sticks onto the spike. And then that antibody then keeps it in that position instead of this position. So then they image the two of them together, and that's how they found out what this looks like. At least that's what they did with the original RSV, the first virus that they did this technique for. I don't know if they did it exactly the same way for SARS-CoV-2, but that's the idea. So you kind of get it. And so then once you know what you've got to look out for, then the thing was to try and stabilize the spike into this shape. So that then is where you get it looking like this. And you have, this is, the original version had just 2 of these proline things. Now it's got 6 of them. That's why it's called the Exapro. These little sphere things. And the red and blue spheres, if you look very closely, that each red one is a little blue one in there as well. And what these are doing is they stick bits of the spike to each other. And then that means that the spike that your vaccine produces can only look like that. It can't turn into that. So, so that the Pfizer vaccine has a couple of those proline things. Hexapro is designed for a second generation vaccine which will have 6 of those, and so that makes this even more stronger. The being stuck together like that it makes it much more effective as a vaccine, so it's always looking like that except like that, but it's not always like that. Apparently only some of the vaccines get stuck together by this protein thing, and then if you use Hexapro, then 10 times as many of the spikes will be the right shape in the vaccine. So this will make a much more effective vaccine once you've got this Hexapro, and it makes it much more stable. So this Hexapro variation is going to make the vaccines, they can now withstand heating to 50 degrees centigrade, and they can be stored at room temperature, which you may know that the Pfizer and Moderna need. The Moderna can stay for a while at fridge temperatures, but with the Hexapro it can be stored at room temperature, and the Pfizer one needs to be ultra cold. So once they add the Hexapro variation onto the Pfizer and Moderna, then there's a possibility that it'll be both a much more effective vaccine and also a vaccine that can be stored at room temperature. And they're experimenting with this at the moment. So that's basically it. And if you want to read the proper science there, then this is, go and read the paper. So this is not my area of speciality. I trained in maths. I understand the maths of when it's, but I don't understand all the intricacies of the biology. But I'm quite good at getting an idea, of the basic idea behind a paper, and understanding what it's talking about. If I've made any mistakes here, please say. I just want to convey the gist of what's going on there. And as you can see here, in fact these are some, if I click through to that, and then I'll bring that up in a minute, then those are some highlights from the paper. And we are doing many other things to get new second and third generation vaccines. Indeed, one thing that is going to succeed is that they're already looking at straight away, and maybe we'll get this rather faster, is to start with, and they're already testing these in clinical trials, in phase 3 trials, and that is to use 2 different vaccines. So part of the reason that the AstraZeneca, it seems to work better if you've got 12 weeks between doses than if you've got 4 weeks. There's good evidence that it does. So the effectiveness stays very high, much higher than for Pfizer for those 12 weeks. It gradually goes down, and then after 12 weeks, then the second dose will push it up higher than if you had the second dose earlier. And so Pfizer actually seems to work best of all if you've got a very long interval between the two, although you are less protected during that interval, obviously. And that's why it actually seems that the UK has actually done a good bet. It was just guessing really, but based on rather limited data, but later data is still backing that up, that actually having a longer interval means that at the end of it, even after 12 weeks, that you are actually better protected after your second dose than if you had a shorter interval. And then there's also varying the amount of the dose. So that's something we didn't know originally. And then, but then there's another thing, is the hypothesis as to why that works, is that it might well be that the vaccine, well, first of all, the hypothesis as to why the AstraZeneca doesn't work as well as the Pfizer, if you have the two doses very close to each other, like 3 or 4 weeks apart, is probably because the AstraZeneca vaccine, then you get an immune reaction to the delivery system. So when the second vaccine gets delivered, and it's based on the exact same adenovirus from chimps that can't reproduce in humans, and that delivers it both times. So what you're wanting to do is get a vaccine reaction to the spike, but what you get instead is a vaccine reaction to the spike, but also to the adenovirus that delivers it. And if that vaccine reaction to the adenovirus is, that's basically a cold virus, and if you are a particular kind of cold virus, not a coronavirus, but a different one, and it's actually a DNA virus, whereas the coronavirus is RNA virus. Anyway, if the reaction to the adenovirus is strong enough in the second time around, then maybe the adenovirus isn't able to deliver the spike very well, because it gets stopped before it goes into your cells. Because the way the adenovirus works is it enters the cells first, and then it goes into the cells. It can't replicate in the cell, but it delivers a little bit of DNA to the core of the cell, which then makes some RNA, messenger RNA, which then makes the spikes. And then the Pfizer and the Moderna ones, they bypass that whole DNA virus entering the cell and inserting DNA, and they instead just take a little package of the messenger RNA and put that directly into the cell. So it's a kind of cleaner vaccine. And so with the adenovirus doing that, then the problem is that you can get an immune response to the adenovirus, whereas the package that is used for Pfizer and Moderna is designed to not have a strong immune response, and you can't really design it so easily for the adenoviruses. So that may be the reason. So then one possible solution is to mix vaccines, and this has been tried before. It's used quite a lot with other diseases, apparently. So if you do the first dose with the adenovirus from the chimps, and the second dose with a different adenovirus, which is the one that the Russians used for the Sputnik V vaccine, and those use different delivery methods. So if you did the AstraZeneca first and then the Gamaleya ones, the Sputnik V one, then that almost certainly generates a much stronger reaction, and you might do it within the 3 weeks, although you might prefer a longer one anyway. There are reasons for thinking it's very unusual for any vaccine for the second dose to be as short as 3 weeks after the first. It's usually 2 months or 3 months. And the reason is that the later of the second dose, the later it is, then you have reactions for the antibodies. Then you have things called B cells, and these develop later. And the later the second dose is, the stronger the trigger of the B cell response. And B cells remember your immunity. So it seems likely that if you leave it a longer time between the 2 doses, that you will then get a stronger and more longer lasting immune response in the end. So people who've been vaccinated twice with AstraZeneca 12 weeks apart, then for a bit in between they got a lower immune response, but at the end they may have a stronger immune response which lasts longer. So if you, this is all things that we will gradually learn as they do more clinical trials, and also do this direct work on the science, and many other things they're doing. And also the therapeutics. So they've got these small molecule drugs. I can't remember the name for them now, but they're designer drugs. And what you do is you look for a little hole in the spike somewhere, and then you design a molecule that will fit exactly into that hole. And you choose that hole in such a way that if you could manage to pop something in there, the spike wouldn't work anymore. And so there are quite a few designer drugs that are based on that approach that's being tested. This is not a vaccine anymore. We're now talking about a therapeutic. You would take this in order to prevent yourself, a bit like the monoclonal antibodies. It's a drug you would take to prevent yourself from getting COVID, or if you have COVID already, to make it harder for it to spread around in your body. And so those are designer drugs. There are all sorts of various therapeutics. There are lots of clever things coming along. There are lots of ingenious stuff being done. But it takes time. And the reason we could get the vaccines so quick is because we had 10 years of experience for developing vaccines for SARS. So we've got 10 years worth of research there. And for MERS, the Oxford vaccine was based on a MERS vaccine. And so they just swapped in a different spike. But they'd done all that research for about a decade, and it's on the basis of that. So we've got new research custom for COVID. But it's going to take a little while, not a decade, because science is much faster now, and they've got vast amounts of funding. But it's going to eventually this is going to come in next year or two. Then we're going to have loads and loads of really very clever, and this is already in trials. The Exapro variation, for instance. So we can expect improvements in the vaccines, which are already very, very good. They never last year expected there would be anything like as good as this. The reason was that we had never had a coronavirus vaccine before. We got vaccine candidates, but they were never actually used for MERS and SARS. So they just didn't have the phase 3 trial data. And they were thinking in terms of being a bit like flu. With flu, the vaccines are not very effective. Even after all this time and all the research we've had into flu, the best we manage is 40 to 60%, whereas with COVID, then it's 80-90% is normal. And then with the variants, then it starts bringing it down a bit more towards the flu levels. But the only reason we've got so many variants is because we haven't been keeping the case numbers down low. That is why the World Health Organization say we've got to keep case numbers down low. One of the reasons. So whatever your beliefs about zero COVID, but there's no reason why we shouldn't. With such effective vaccines, zero COVID is well possible just with the vaccine alone. And bear in mind that nobody has ever eliminated flu from a single country. I don't think there isn't a single country worldwide that doesn't have flu. As far as I know. Do tell me if there's something I'm missing there. But and certainly they have flu in New Zealand, they have flu in China, they have flu in Taiwan, Vietnam, all these places, they have flu. And those are countries I just mentioned that have eliminated COVID as a local disease. So New Zealand, it's still got flu, it's got much less flu because of all the precautions people are taking, but it's still got flu. But it has eliminated COVID except when it's introduced from other countries. So this shows that COVID is not like flu. We just couldn't do this with flu. And they did that without a vaccine. They stopped COVID completely without a vaccine, and it only came in if the rest of the world hadn't had COVID. If it was only New Zealand in the entire world. In fact, if you could somehow create a new planet and transplant China, Taiwan, Vietnam, New Zealand, Australia, Laos, and then probably you could also take Singapore and South Korea and all the other countries that aimed for zero, but then also had all the problems with incoming cases. If you could take all these countries and somehow put them on a new planet, then it would remain zero COVID, because those are all countries where their cases were eliminated, and then they started again because of imported cases from other countries. So if they only had each other, then it would be gone. And that's a fifth of the world population is COVID-free, apart from imported cases from the 4/5 of the world population that haven't stopped it. And we could never do that with flu, at least not with either the knowledge we have so far of how it spreads, or the medicines, the vaccines we have so far. Even with the vaccine, we can't do that with flu. We can do that with COVID without a vaccine. So, and then we've got these very effective vaccines. It's much better than the flu vaccines. And add that on top of a disease that we can already eliminate, unlike flu, by public health measures, if you do it carefully enough. And people keep saying, but we've tried so hard in the United Kingdom, say in the United States. United Kingdom, we certainly tried very hard. But the reason is we did it the wrong way. We just used lockdowns. And they still haven't got test, trace, isolate really working properly in the United Kingdom. And they still, but most important of all, they have not yet managed, and they haven't even tried, to get people to isolate away from their own household. When you are in lockdown, most of the transmission is, naturally enough, to other people in the same household. And people are just used to flu. And I get that people saying that to me over and over. We can't stop it because you can't stop flu. And this is the same thing. This is not flu. It's a completely unrelated disease. Coronaviruses are not even related closely to flu. And they're just a completely different disease. So what you ask, and if it was something like Ebola, for instance, then it's well established, everyone agrees. If you've got Ebola, you don't stay at home in your family with Ebola because the other people in your house will get it. It's the same for SARS. If you've got someone in your house with SARS, then you wouldn't just try and look after them at home. You'd be ringing up the doctors and saying, can please take us to the hospital because it's deadly, very deadly. 1 in 5 of people with SARS die. And they learnt that very quickly in China and in Taiwan, that if you've got a house, if you've got someone at home with SARS, then you want them to go to hospital, you want them to be isolated. And it's very important in hospital also to be isolated. And SARS and MERS, but SARS, that spreads very readily outside hospital. MERS is mainly spreads in hospitals. But SARS, that spreads, it spreads much easier than COVID does. In one flight, I think it was from Hong Kong to Beijing or something like that, 22 people got it from a single index case in the plane. With COVID, nobody, I don't know of any cases in the literature where it has been managed to infect anyone in the same plane. They get infected before they leave or between journeys, but not on the plane flight. So it's a very different disease even from SARS, and it's very unlike flu because it just spreads in a different way. It does spread in crowded locations, but only when you've got very poor ventilation and with people doing strong physical exercise or singing and stuff like that. So that's what COVID is, just a very different disease, and it can be stopped. And it can be stopped without a vaccine. And yes, so I was just explaining that in the United Kingdom, the government here they're not scientists. They're politicians, they're classic scholars. They don't seem to understand really how science works. And they have these secret consultations where the scientists, they have a certain small group of scientists that they trust that tell them what to do. And they don't listen to any other scientists. And then you get other scientists saying that's not right. And then you don't get what you should have is a systematic review and listening to all the different discoveries and findings about COVID. But they don't do that. And so if they had listened carefully to what the people are saying in China in January, and then the WHO China in February, they would have realized that the Chinese already knew in January that most of the transmission is through households, and that the most effective way to stop this virus is to isolate people away from their own household. And it was just so sad that Mike Ryan, he made that very forcefully in one of the press briefings, and this got spread as a rumour that the World Health Organization wanted to take children away from homes, and the rumour just didn't explain why. It made it sound as if they're just an evil organisation that wants to remove children from their parents, which had the opposite effect of people wanting to not let anyone take their children away if they've got COVID. It wasn't even about children, it was about adults. It wasn't about forcefully removing people, but about just educating people and saying, look, this is how it spreads. If you know how it spreads, you will want to be isolated away from your household. Because who wants to give it to the rest of their household? Very few people would want to give COVID to their granny, say. If you care about whoever's in your household, whoever's in your house with you, then you will want to isolate away from your house. And this is the most effective way to deal with this. So, first of all, if you are a case, then a lot of people think, again by analogy with flu, that once you're starting to feel sick, then you've infected everyone in your household. And what kind of fuels that belief, which is a false belief, is when people hear that you are most infectious right at the start before you get symptoms. Well, that is true, but you remain infectious for a lot longer, and then it's much less uniform than flu. After the first day or so, you mightn't have infected anyone. Indeed, most often, it's not very infectious. It's a surprisingly uninfectious disease. Even when you've got a couple living together, typically only 1 in 10 will be infected when you've got a couple. Very unlike flu. And then it seems to spread in very rare, even in households. Then spreading in households happens through super spreader events that you've heard so much about. So it'll be some event, some mealtime or some game or something, whatever it is, some particular event, some family gathering, and maybe you get in all your relatives and you have a big Christmas get-together, and you're all crowded together in a small space, and you're singing or shouting, and then everyone gets COVID. And that's typically how it happens even in households. So if you are the first case to get it in your household, most often you haven't given it to anyone else in your household, because there's super spreader event, which may involve lots of people in a small space singing or whatever is the reason. There could be many reasons for a super spreader event. It hasn't happened yet. If it hasn't happened yet, and if you isolate away from your household quickly, and that's even if you're a partner, even if it's a couple, if you can isolate away from your partner quickly, then you greatly reduce their risk of getting it from you. And the World Health Organization have been saying this with every single press briefing in January and February of 2020, March, April. Now coming to this year, they've more or less stopped saying it. And it's so sad, because this is still just as important. But they've clearly learned that talking about this is counterproductive. And people are just not listening to this. But last year, towards the end of the year, Mike Ryan said that his one golden wish would be for people in Europe, United States, he was talking about Europe at the time, but it would mean also the United States and other countries, to isolate if they are a case, and to also to quarantine. So quarantine is if you don't know if you are a case, but to be separated away from others in your household if you are a contact. Now, if you are a contact, that's even more effective. The idea And people don't understand, most people I talk to don't understand why you quarantine. It simply hasn't been explained to them. So if you are there again, and that's again the United Kingdom saying, if you get COVID, then quarantine together with your family. That's what they say. And then try and keep away from the most elderly and most vulnerable. And so you get this idea that quarantining is mainly to avoid spreading it out into the community. That's only a fifth of the transmission happens that way. And the idea of quarantine is if you are a contact, that means that there's only a small window of that means that if you were talking to someone who had COVID within 1 metre, say, and you talked to them for 15 minutes, you would then be a contact. If you did that from 2 days before they develop symptoms and any time after they develop symptoms, then you are a contact. But remember, even with couples, only 1 in 10 of the contacts actually have the disease. It's even less if you're not a couple. So you are a contact at that point. Now, the next part of the puzzle is that it typically takes 5 days before you develop symptoms. So that's for 3 days after you had this contact, you can't infect anyone. And you will test negative if you are tested. And so if you can then get to the contacts quickly enough, so that's why it's so important to get the test results back quickly. In China, they got the time to get your test result back for a PCR test in January with 70,000 cases total. I'm not sure how many they had a day. I'd have to look it up. They got the time from you went into the hospital and then 4 hours later you got the result of the PCR test. Basically had the PCR machines just running all the time in the hospitals on site. So your swab went straight to the PCR machine, then you got the result back immediately. That's about as long as it takes to get a PCR test. And so with that, then that meant they could immediately isolate. So if you got COVID, you would go into the hospital and then they test you on the spot. You would then isolate. They would then take that. Then you would then be isolated. You wouldn't be sent back home. They don't want to send you back into the community, wandering around with COVID to infect whoever you might meet on the bus back or driving you back or whatever, and everyone in your household. They would not do that. Instead, they would offer you the ideal thing is a proper COVID ward, where you've got experts there, even though you've got no symptoms yet, maybe you've got only very mild symptoms, you feel perfectly well. That's why they had these huge wards in stadiums in January. You saw those photographs of those, and then in the United Kingdom we made these huge Nightingale intensive bed wards, but that's not what the Chinese ones were. The Chinese ones were quarantine wards. Those big things with all those beds in a stadium. And the main job was to stop people from getting bored, because they felt perfectly well, but they had to be isolated away, quarantined away. I think those were the isolation ones, were the ones who were cases. They also had the quarantines as well, which were people who didn't know if they were a case or not, but they were a contact. And those also had to be isolated. For instance, and we could do that in quarantine hotels. Obviously, that's going to be a huge undertaking when you've got thousands of cases a day. But once we're down to, say, a dozen cases a day, say, then what we should do, absolutely should do, is that we should get the fast turnaround of 4 hours. As soon as and we should not send people back to their homes. The general public needs to understand this and know why you're doing that. Otherwise, it will seem like it's being very coercive. And once they realise that they're protecting their own family by doing that, then who would not want to go along with that? So then they will get free accommodation in a hotel, everything paid for them, because you want to encourage them, especially once you've got down to a few dozen a day. Then put them up in the Ritz, a very posh hotel if you want. That's what's needed in order to get these people to isolate and quarantine. use the carrot. Free Wi-Fi, free everything they want, and dog walkers to take their dogs for a walk if they've got a dog at home, and people to feed the cats and dogs, and just put all that on as if they were on a cruise ship, for instance, holiday, everything being done for them, and then that would be the way to keep it really down very, very, very low, very quickly. So so do that, and then they can't infect their household. It's just so sad. All these people who have died, basically, and these journalists did this cheap snide remarks against Dr. Mike Ryan, so claiming that he was trying to take people away from their homes. Fox News, I think, was one of the ones who ran it, but I think there were several who did it, who ran this story claiming that the World Health Organization were going to take your children away from your homes. That must have led to thousands and thousands of people dying as a result of that. So journalists have to be very careful. You have to be very responsible during a pandemic like this. Small things you do that just seem like, oh, this is a good clickbait story, this will run well with our readers, can kill people. Not intentionally, but it can have that effect. So it's just so sad if you think all the people who've died because they didn't know this and still don't know this. And not just them, but also even if nobody in their household does die, because they then pass it on to people in their household who then mingle with someone else and then goes to another household, which would never have got it if the first household had isolated away from the rest of them. If the first case had isolated away, the others wouldn't have got it. It wouldn't, say for instance, one of the people is a health worker or a care worker or works in a hotel or something, and then they're going out to work and they give it to someone else. It's an essential care worker of some sort, an essential worker of some sort, and that's how it goes on and on. So during a lockdown, we're in a lockdown in the United Kingdom at the moment, and people still don't know this. We're on about our third lockdown, I think, depends how you count. And still, the United Kingdom doesn't seem to have understood this yet, which the Chinese understood in January. Now, it's not because the Chinese are better. The Chinese had the previous experience of SARS. So when they came to COVID, they thought, oh, this is a disease like SARS. So they dealt with it like SARS, with the isolation, the quarantine, test, trace, isolate. Whereas in the United Kingdom, we haven't had this experience of SARS, so we thought of it like flu. So we treated it like flu, where the aim is to slow down the spread, and it seemed quite like flu because it wasn't as serious as SARS. And they just don't have the mindset to really properly think about the need for quarantine or isolation. So that's basically what's happened. And it's just people going by analogy and not doing proper scientific thinking. And hunches are very good, but you need to inspect your hunches for consistency and challenge them against things that challenge them. Not just evade things that are awkward and that don't really work with your way of reasoning, but look very carefully and see, am I missing something? Have I got something wrong here? And so anyway, so we have these wonderful vaccines, and these are definitely going to work, going to help a lot. And I think that once we got to the second or third generation, it's not just me, the World Health Organization is saying that. Once we get to the second or third generation, we will really be able to stop this pandemic. But we could stop it so much faster if people were to realize how effective these public health measures are and were to really do them properly, and especially isolating away from the household, and because that's 80% of the transmission, we can stop most of that 80%. And so if you've got an R0 going up, just even slightly, you're 1.2, 1.3, that means it's going to be running away up and up and up. Then if you can stop a fraction of 80% of that, even if you just sort of half the people do it, and that stops half of that, so you drop it 20%, that would change a 1.2 to below 1, to 1.1 to below 1. And if you had, say, 2/3 of people do it, you stop 2/3, then it would bring it way down. And it would just go down and down, and then it's gone. Just through that alone, without the vaccine. And then we've got the vaccines on top of it. Anyway, that's it. I'll upload this and see. The main thing is that things are looking very good with the vaccines. They're looking very good with therapeutics. There's just it's just so sad that these basic public health measures and the kind of history of how things has gone has meant that the world has basically gone two ways. There's a fifth of the world population thinks of it like SARS or treats it like SARS, and they've eliminated it. 4/5 of the world population thinks of it like flu, treats it like flu, and they are not eliminating it. They're not even trying. When they get close to zero, then they open up again. But this time around, the United Kingdom has finally understood that once cases are going down, you've got to keep them going down. So they are taking that approach. But the only tool they've got really is lockdown. They're not doing the test, trace, isolate properly. So the test, trace, isolate is done on top of that, and then physical distancing and masks, but not really the test, trace, isolate. Because still, most people are not isolating, most people are not quarantining. I think hardly anyone understands that you protect your household by isolating or quarantining as a contact. That is just such a rare thing. So few people understand that. And this is just missing what is probably the most effective tool of all in the toolkit, is isolating and quarantining the people who are cases. Because if you isolate a case, the virus stops with them. If you quarantine, then if they've got the case, it stops with them. And the other thing is the physical distancing, and the mask wearing, but physical distancing, very important. If you don't need to be close, don't be close. If you can step back, and when you're talking to someone, then step back. There's so many people who, once they wear masks, and this is true also if you're vaccinated, still step back. If you don't need to be close, step back. Doesn't matter if you're vaccinated, doesn't matter if you're wearing a mask. This will make a huge difference. And if we got more people doing that, and more people wearing the mask, then that by itself would turn it around again. Because you just look around, and most people are not wearing masks, most people are not stepping back, even now, except where it's absolutely required. So if more people did that, think what a difference that would make. It doesn't take much to turn an R naught of 1.2 to an R naught of 0.8 or 1.1 to 0.9. Doesn't take much. If, say, only a half the people are doing it right, to increase it to 3/4, just wearing a mask, just any of these measures. And this is the way out of lockdown. So this is another thing hardly anyone knows. The reason we are in lockdown in the United Kingdom is not because of the variants. The reason we are in lockdown for the third time is because people haven't been wearing masks and haven't been physically distancing. They've been wearing the masks improperly, like, around your chin, or below your nose, all these things that people laugh and make fun of it. But this is the reason we're in lockdown, because of that. And because they're not physically distancing. It's the only reason. If at that plus not isolating, not quarantining, not testing, not doing the tests fast enough, because you need a very fast turnaround for the tests. If it takes more than 4 hours to get the test results back, then we still haven't advanced beyond what the Chinese were doing in January 2020. And I don't think we've reached that point. That is a target we're nowhere near even reaching, as far as I know, in the United Kingdom or United States. Maybe in the future, maybe with Joe Biden's big bill, then that's going to help with the testing and things. But so again, if your turnaround time is measured in days, then you're missing an awful lot of your contacts, because some of your contacts will get the disease before you get to them, because you just don't know that you're a case. So, so that as well. If you can turn around the contacts and do it in 1 day instead of, say, 3 days, and that's a huge, huge difference for the tracing. And then if people don't isolate when you ring them up about the tracing, because they don't understand, and then it also needs support. So as the numbers go down, we've got to support the people, so they will isolate and quarantine. Anyway, so many of my viewers will know about some of these things already. I don't want to go into a lot of detail, and I just reminded some of you of it. I've been talking about this with most of my videos about COVID, that we need to do these things. Anyway, I will upload this now.